We have another question here. What cases are most predictable with Candid Pro?
Okay, now this is where I want to get positive because there's a lot of cases that we can treat with Candid Pro. You know I spent some time with those that are not predictable, but I think it's important that we understand that not every malocclusion is right for aligner therapy and with Candid Pro aligners. But there's a lot of things that we can accomplish with aligners, and mild to moderate crowding is like the bread and butter of tooth alignment for even the orthodontist and the general dentist. These types of cases we can manage with aligners very, very well. We can see cases with anterior crossbites and single tooth anterior crossbite here with tooth number 7. Even if number 10 were in crossbite, we can treat those cases very well with aligner therapy. So once again, we have a moderate crowded case, somewhat narrow arches that can be broadened, and an anterior crossbite. Very much, we do these on a daily basis. Thinking about class 2 cases, if you look at the case on the right, on the left of the screen, you can see that the class 2 is smaller than it is on the right side of the screen. On the right side of the screen in the orthodontic world, we call that a full class 2, where on the left side of the screen, we call that an end-on class 2. Now, the one on the right is much more difficult to correct with aligner therapy alone, unless we were to add adjunct forces such as class 2 elastics or other types of adjunct forces. Whereas the one on the left that has this end-on class 2 or a half cusp class 2, some people would call that, these we can treat quite nicely with aligners. We might not be able to achieve a full class 1 with the one on the left, but we can get very, very close to it. Spaces, this once again, bread and butter of aligner therapy. Closing spaces is pretty much something that we can do. There's not a lot of issues that we cannot do with closing spaces unless they're edentulous spaces in the posterior. But anterior closing spaces, once again, we do that on an everyday basis. When we look at narrow arches, we talk about narrow arches as a very common thing to treat with aligners. We look at this lower arch, we can see the thing that has caused the narrowness of this lower arch is the lingual inclinations of those posterior teeth. Now we know that the mandible, the bone is not able to expand like the maxilla is because the mandible is shaped like a horseshoe and doesn't really have a suture that we can separate. The only way we can expand, quote unquote, expand the lower arch is to actually upright the posterior teeth that have been lingually placed. So we're not really changing the foundation or the bony trough of the mandible. We are just getting those roots, uprighting those crowns on top of the roots that are already within the bony trough. And in doing so, we are able to gain arch length. And I will come back to this a little bit later when we come to expansion to show you how much arch length we can achieve. But these types of cases, every day we're doing these with Candid Pro aligners in gaining space in the lower arch by uprighting lingually placed molars. Deep bites on the left, you can see we can correct those with aligner therapy. Sometimes we will use bite ramps and things like that to help us, or attachments, but we can very much treat deep bite cases. And mild open bites like the one on the right, as long as the tongue is not there, definitely we can help close that. Many times attachments are needed for that, but definitely we can work with closing anterior open bites.